is Cheryl Erickson, and I'm the Indigenous focused ECE instructor with Louis Riel Vocational College. Today in Nutrition, Health and Safety, we are going to explore managing infectious diseases in young children. Before we get started, I'm going to just remind you to please read your chapters, as this video is not a replacement for your chapter reading. So as we talk about childhood illnesses and infections, they are very common in large group settings, in particular daycare centers when we're caring for younger children. And why is that the case? It's because it's a lot of person-to-person contact. Sometimes it's more so the time of the year here in Manitoba, long winters, not getting outside enough. Often a lot of illnesses and viruses spread more quickly. So there's different types of infectious diseases that we may see in the childcare environment. We could have viruses, things like measles, chickenpox, colds, flu are very common. There's bacterial ones. Tuberculosis is a bacterial disease, as well as pneumonia. There's fungal ones that you might see, ringworm, athlete's foot is another, and the parasites, which we see in daycare centers, often head lice or scabies. How do these diseases spread? Direct person-to-person contact is one way. Indirect could be by picking up an object that's been contaminated. So for example, I have the flu and I cough into my hand and I pick up an object. I've now coughed, there's germs, bacteria in my hand, and now I've picked up the toy, I played with it, I put it down, and another person comes and picks that up, touches it, and then it spreads that way. Droplets, a lot of things are spread through coughs and sneezes. It's amazing how far a sneeze and cough can travel. I believe I read somewhere that if you were to sneeze and not cover your mouth, that it could travel a foot. And so, or 2 feet. So, you know, I could sneeze and potentially contaminate somebody sitting at a table beside me if I have some type of illness. And again, that's airborne, as well as the sneeze, the wetness, or the cough. Those droplets contaminate as well. Bloodborne transmission is infections that are contaminated with blood. In a child care center, we're going to use universal precautions, which we'll talk about later, to reduce the risk of that type of contamination. So with any type of illness, we look for symptoms. Usually, if illness is going through the daycare center, we've become aware of it because a parent will generally call and say, my child isn't coming to the daycare center, they have this. A child care center is responsible for posting an infectious diseases notice. So for example, if I have received a phone call from a parent telling me that their child has the flu, influenza, I will now post a notice to all our families that we've had a confirmed case of influenza. And then I'm going to make myself aware of the signs and symptoms, and I'm going to monitor the children that I'm caring for. So I'm going to watch the children and how they're playing. I'm going to make sure that, you know, nobody's coughing a lot. I haven't noticed any rashes or vomiting. The child's is behaving like normal, so nothing's happening there. But all of a sudden, if a child becomes lethargic and doesn't seem to be their normal self, I might feel their forehead and see if they're hot, and then take their temperature to confirm whether there's a fever or not, and then contact the parent. There's other symptoms involved with infectious diseases as well, or illnesses. You know, with the flu, sometimes diarrhea is a common occurrence, and so that's a really frequent loose discharge of watery feces. And also respiratory type of illness, so colds and coughs, ears, sinus, throat, pneumonia, types of, you're displaying coughing and maybe you've been diagnosed with that. You have symptoms for those types of illness. And those skin, that bacteria, the fungus, is often caused by some type of virus. Preventing and controlling infections. Of course, hand washing is the number one way we control it in a daycare, especially for those viral things that just spread through the air, your common cold and your flus. Although you can't prevent it once it comes in, you have it, but you can reduce the spread of it by implementing some very strict hand washing, cough, sneeze etiquette policies within your center, and lots of reminders of children and teaching them those steps. There's some immunizations out there that does prevent, so you can be immunized for chickenpox, measles, mumps, rubella. And with those immunizations, there is little risk that you might come down with those types of illnesses. And again, immunizations is another topic in a family's choice as well. You can have some health practices in your facility regarding keeping your staff healthy, screenings, a good health benefits package is good for daycare staff because it gives them opportunities for vision, dental, hearing exams that are free or covered, a good supplement coverage there. So those are opportunities for your employees. There could be TB testing, tuberculosis, and that's something you as students are required to do prior to your practicum as well. And again, good hand washing practices is really helpful in reducing the spread of illnesses. Again, conducting those daily health checks because we want to ensure that it's not spreading to other children. Cleaning and sanitizing is a huge practice that daycare centers will do. Not only washing our toys daily with soap and water, but in between spraying it with our Quat or our Javix and water solution to reduce that risk of anything spreading on the toys and equipment. Ensuring that if you see a toy being mouthed and put down, that you automatically put it in a sanitizing bin to, again, reduce the spread. And really good practices regarding diaper and toileting procedures. And there are strict guidelines and policies that you follow in diaper changing and toileting. And those we'll discuss later on as well. How do you set some standards for precautions? And that's guidelines to spread disease, blood transmissions, our blood transmitted types of diseases, our universal precautions is another term I use, and really that is providing that barrier using disposable gloves. And so we should be using disposable gloves for caring for the child that has a nosebleed, for bowel movements. Changing bowel movements is a good practice as well. And then cleaning and sanitizing all the surfaces where you're changing or where blood may have dropped onto the floor or chair. Changing clothes is really important too. If a child's had a nosebleed and it's gotten on their top and their pants, you need to change their top and pants and launder that as well. That's just caring for the child. Too. Teaching children preventative health practices. Children are very capable, even as young as 2 and 3. You can teach them sneeze and cough etiquette, coughing into their arm versus coughing into their hands, how to wash their hands, singing songs and making it fun. I always recommend Happy Birthday is a good song to sing. Your hands need to be under the water, rubbing with your soap and water until you finish the full happy birthday song. That's the adequate amount of time your hands should be in the water, rubbing that soap around. And then you know your hands are clean. And engaging their own body, that getting to know the signs that they're not feeling well, and telling them about that. So if a child is telling you that they're really tired or that they're sore, their throat is sore, you can say things to them. I think you're really tired because you're not feeling well and your body isn't as healthy as it usually is, or your throat is sore because you're sick. And you need to go see mom's going to take you to see the doctor. So little things like that teach them about how their bodies work. We also work with families. We have some really good, strong communication skills that are established with our families. And if a child is not doing well in the center, they have a fever, or they're telling us that they're not feeling well, we want to let the parents know. The center is going to have policies that stipulate with certain illnesses if a child has to be picked up immediately, time-wise that they might have to be away if they are diagnosed with a certain illness. So, for example, if it's pink eye, we notice that the child's eye is very red and that it's got a discharge coming out of it, we will immediately contact the parent because we will want to know for sure, is that pink eye. Pink eye is very contagious and does tend to spread quite quickly in a child care center. So we will ask the parent to take the child to the doctor. If it is confirmed by a doctor that the child does have pink eye, regulation regarding pink eye is that a child must be away from the daycare center for 24 hours on antibiotics before they return. So that's just how it would work. It's telling about the policy, following that policy, because that does help to reduce the risk of it spreading to other children. So good communication and good follow through with the family in getting that child treated on that antibiotic as soon as possible, and then it's treated and they can return after 24 hours. When we do notice that a child in the daycare environment is not feeling well, or we've noticed that, for example, we feel that they probably have pink eye, they've got this discharge coming out of their eye's quite swollen, we will remove them from the play area to an isolated area. Often that isolated area is going to be in the director's office with the director. There might be a couch in there and a play table and toys. We're going to have the child remain in that room with a staff until the parent arrives. And why we're doing that, again, is to reduce the risk of pink eye spreading. So maybe it'll take the parent an hour to get there. In that hour, how many times do you think a child can rub their eye because it's itchy and swollen and bothering them, and touch a toy in that room? And then how many times is somebody else going to pick it up and then eventually touch their eye? So potentially pink eye could spread to a large number of children in a short period of time. So we want to care for all the children. We want to make sure that it doesn't have the opportunity to spread to a large number of children. We also want to keep track of illnesses. So we're going to have a chart and we're going to track the date, the name, the symptoms, especially if now we've noticed, like, okay, we've had one case, now we've had 2 cases, now we've had 3 cases. That's a lot. What's happening here? Why is it spreading so quickly? What are we missing? And we might want to contact the public health nurse for some assistance. And can you come and help us? We've noticed that we've had now our 7th case of the flu, and it's getting out of hand here, and we want to know what we can do so that it isn't spread to any more children. So utilize those resources because they're there to help you when you need them, and they're there to help prevent things from getting worse and to support you in your daily practices. So we have talked about vaccinations and again, a family's choice, and consult a medical professional about that. However, I did want to make you aware of the vaccinations that can prevent diseases, and so one of them is the pertussis vaccination, also known as whooping cough, which is very highly contagious. And as I go through these vaccinations, you probably might have heard of them in the past and have, when I think of whooping cough and highly contagious, there was a time or era in life and in the world that something like whooping cough could cause death. And so we've had these vaccinations created, and people through the different decades have lived longer because they didn't contract something like whooping cough. Meningitis you can be vaccinated for that as well through a Hib vaccination. Chickenpox is a skin rash. It's like little blisters that come up on your body, and they ooze, and you need to they need to dry out. It has to run its course. It'll be a rash, maybe little blisters will form. They'll open like a cold sore almost, and then they just dry up and eventually go away. There is a vaccination for that. Just want to make you aware of as well that chickenpox isn't a illness that children are required to stay out of childcare or school. So if you do contract chickenpox, children still can attend daycare and school if they can function. I mean, if they're really sick with it, no, but if they've got a very mild case in a few spots, they're okay to come to the daycare center, because chickenpox is contagious before those spots come out. So a child is going to be contagious within that environment, and once those sores come out, they're really not contagious anymore. So everybody's affected in that situation if they're not immunized. Measles is very highly contagious. Again, measles can be a life-threatening type of situation depending on where you are health-wise. Tetanus, flu, we can be vaccinated for the flu, hepatitis, and streptococcus pneumonia, so respiratory ear infections. So there are a lot of different vaccinations out there that keep us healthy. Some other common communicable illnesses and infections in childhood and that we see a lot, and when I go through this list, I can tell you that we probably see all of the list throughout the winter months in a daycare center. So colds, pink eye, croup, which if for children, croup is like laryngitis. It's similar to laryngitis. For us as adults, we get laryngitis, children get croup. Strep A infections like strep throat, ear infections, fifth disease, often that is referred to as slap cheek because it appears a big red rash on your face, and it all might look like a slap mark. Pinworms, RSV is usually very common in the winter months, which is a respiratory, and TB. Infections and acute illnesses involving the skin, these are very common as well. Head lice, it's not life-threatening, it's not an infection, it's more of a nuisance. It involves eggs and louse laying eggs in your hair, so you have little bugs running around in your hair, laying more eggs, transmitted person-to-person contact. They do not fly, they do not jump, and so to treat that, it involves some type of shampoo treatment. There's varying forms, and again, I would recommend talking to a healthcare practitioner about that for proper treatment. And a lot of cleaning and laundering and vacuuming is involved in that. Scabies, is mites that burrow in the skin, ringworm, it's a fungal type of infection, hand, foot, and mouth disease, very common, bite wounds, also common, and staph infections as well. So a wide variety of things that you would see in a child care center, as well as the bloodborne infections in early childhood settings that honestly, I've had 25 years plus experience in child care centers. I have not had experience with hepatitis B, C, or HIV. Not very common. Common diseases among immigrants or adopted children. So you could see hepatitis. Depends on, you know, where the country that you're coming from and what the what the lifestyle is like, how you live. A lot of countries are poverty-ridden. There's a lot of health issues. There's not access to clean water. And because of that, there could be a lot of skin, hepatitis, TB. So definitely a lot of treatment involved there, and risks to their health that can be treated here in Canada much better. So that does conclude Chapter 10 today of Nutrition, Health, and Safety for Young Children. Please do see your instructor if you need any further clarification on some of the information we've discussed in Chapter 10, or to check in to ensure you haven't missed any handouts or assignments pertaining to Chapter 10.